best thing about being a GP is the variety. Every single patient is different. Feeling a bit better? Ooh.
The hardest thing is the intensity of the workload, to be able to do things the way you'd want to do them in the time that you have. I still think this is nothing to worry about, but there is a very, very rare condition that is more urgent that we get it seen.
I never come to work and think this is going to be a boring day, because no matter what happens, it's never the same.
I've dislocated my finger.
Were you trying to relocate
Yes,
it yourself?
So with those urgent referrals, they are referred on what's called a cancer 2-week wait referral. It just means that anyone that we're worried about with an unusual lesion, we want to see within 2 weeks' time.
Farnham Road Surgery, how can I help?
Sarah Brookman. Sarah? Hi, come
Hello, mate. How you doing?
I'm well. Thank you for waiting. Sorry about the delay.
That's okay.
How can I help today, Sarah?
I found out I'm pregnant.
Oh, wow. Congratulations.
Thank you.
Okay. So this is the first appointment that you've come in for.
Yeah.
So you are baby's dad?
Yeah,
I have to ask. I do it. Let's see. Okay. When was your last period?
The 6th of May.
6th May 16. When did you do the pregnancy test?
2 days ago.
That's positive. Lovely. So.
You're very soft-spoken, you know that. You're very like.
Is that a good thing?
That's a good thing.
I'm saying the 21st of February next year.
Okay, should we check?
Yeah, go for it. I want to bet on this.
Better father. Doctor's right.
Yeah. Okay, it says here the 10th of February.
Oh, damn it.
Don't worry.
I was that close.
And you are exactly 6 weeks today.
Wow.
Okay, and
That explains a lot. I'm taking pain.
have you ever been pregnant before?
Yeah, I've got 3 children.
You've got 3 children. Any other pregnancies apart from the 3 children?
Yeah, I've had a miscarriage.
Okay.
I had that last year.
Any?
At Christmas. No, not last year, the year before, 2014.
Okay. So, this is the form that you need to take with you when you go for your scan, okay? Otherwise, they won't do the scan. It's really important to keep this one safe. Give them a call, and like I said, book the appointment for 12 weeks, so that's in 6 weeks from now. Book an appointment now with the midwife for your 8 to 10 weeks, so 2 to 4 weeks from now, and book an appointment for your blood test.
Brilliant.
And congratulations.
Thank you very much.
The only other thing I wanted to mention is there's lots of information about things that you can and can't eat in pregnancy. I'm sure you've had it all
I
before.
know, don't worry, I've already been into the calf like, oh my God, I can't eat runny egg.
But I can, so...
No, he can't, no.
Absolutely.
Brilliant.
Lovely. All right, then, guys.
Thanks very much.
Lovely to meet you.
Cheers,
All right,
thank
bye-bye
you.
now. Lovely to
Take
meet
it
you.
easy, see you later.
Bye-bye now.
Positive, mate.
In we come. Come and take a seat. How are we getting on?
I'm here for
The other injection.
the other injection.
How did the first one go?
Okay, it's been easier
That's
to move.
steroid is a fantastic drug, but it can have short-term and long-term effects.
Yeah.
What does it actually do?
It's the best anti-inflammatory that we have. Really, it's better than all of those things like Nurophens and all the tablets you can take, which are anti-inflammatories. But this is a steroid type anti-inflammatory. The other ones are non-steroidal anti-inflammatories, and it's a fantastic drug. Except long-term use can cause lots of problems, including diabetes. Strangely, you can actually turn somebody into a form of diabetes with it. So I'm pleased that it helped.
Yes.
And you're happy for me to
Yes,
have
I
another
am.
go?
Yes.
Fantastic.
Brilliant.
Good. I'll get it ready.
You're great, yeah.
Well, I hope this one's as effective as the last one. Prick now. Are we ready? All done.
Okay.
Brilliant.
Thank
You're
you
right, you
very
can breathe again now. Well, you came up saying you're short of breath, and now, now she's stopped breathing altogether. Very good. Okay.
Yeah.
You can't do too many of these, as in, you know, you can only do 2 per shoulder per year.
Right.
Okay, so it's a matter of waiting and seeing how that goes now.
Okay. Thank you very
Lovely,
much.
well done.
indeed.
Good to see you too.
Thank
Let me
you.
get this door.
Good night.
Thanks very much. Always good. All the best. See you later.
Bye.
Cheers, bye-bye.
You okay, my love?
I rang up this morning, prescription, Mr. Bronivisky. I mean, I got a new hip, a new back, I need a new eye, a new nose, and new teeth.
Yeah, I'm a bit like that.
Well, bionic.
Come and see Hannah.
Hello.
Okay, so I understand we're worried about the left eye, is that right?
Yeah, but in the night time, it's very visible. But the daytime, when you try to see it, it's not very visible.
Where do you notice it?
It's a pupil, you know, the white spot on the pupil, left hand.
Have you got a picture?
Yeah, yeah. Easily you can see it.
Yeah, I see what you mean. Let's have a look. It's just on the left that you're noticing?
Yeah, left, yeah.
Yeah, I think I see. It might, but not necessarily, be that you can get something called a congenital cataracts.
All right.
So they get like a whiteness, which I think is what you're seeing when you're taking that picture.
Yeah.
So I'm going to write a referral.
Oh, all
So
right.
you should get something in the post.
Okay,
At
from
the
the eye specialist.
From the eye specialist, yeah.
All right.
And at the moment, I don't think we need to do anything else other than to get them to check it.
All right.
I don't think it's going to cause any problems right now.
Okay.
Okay, so
Yeah, we just worry about
yeah,
it.
which I can understand. Yeah,
Yeah.
of course. Yeah, and the thing is, every time you're seeing it at night when you're checking the picture.
Nighttime is you can see easily, and
Yeah.
it seems like bigger.
Yeah, and otherwise we'll check again in 2 weeks' time anyway, because you'll have the appointment for the 8-week check. So we can always re-review it at that stage.
Yeah, yeah, because 8 weeks we're coming back.
Yes,
so-
exactly, to do the normal stuff and the immunisations and things.
Yes. Thank you very much.
No problem. Okay.
Bye.
Take care. Sam. Initially, I thought this was going to be a routine referral, but there were a few factors that made me worry about the patient, even whilst I was initially consulting, which made me think actually I should look into this a bit more. Have a look at this. The way it presented was a bit different, and it made me wonder whether this could be something more serious and rare, like a retinoblastoma. Oh, hi there, it's Mustafa here. Hi, I've just seen a patient, Hussein Khan. It's a 6-week-old. I'm just wondering if the parents are still in the waiting room, because I think they were going to get him changed. I just wanted to speak to them again. Retinoblastoma is a malignant cancer of the retinal cells of the eye. If it goes undetected, ultimately it can be life-threatening. Oh, actually, it's okay. Halima's going to go down and have a look for me. Thank you, bye. Oh, hi there. Are you able to put me through to the eye casualty? Oh, hi there. This is Dr. Jiwanji calling from Farnham Road Surgery. I'm just calling about a patient called Hussein Khan, who I'll be sending to the eye casualty tomorrow with a letter. Thanks, bye. Sorry, I know you've gone and I've told you that, don't worry about it. But the thing that you said about the photo and noticing it in the dark night, it made me think about something. I still think this is nothing to worry about, but there is a very, very rare condition that is more urgent that we get it seen. So what I think I'm going to do is I'm going to write a letter for you to take to the eye casualty tomorrow.
Okay.
Okay? I still think it's nothing to worry about. I still think it's going to be something that is, even if there is a problem, they'll be able to deal with routinely. But there's just this one rare thing that can present with this thing about being more noticeable in the dim light. So I just want to double check on that. So I'm going to write that letter now. I'm going to give it to you in an envelope. So King Edward VII Hospital. So you go there, you pass on where the eye casualty is. Okay. Awesome. Okay, bye.
I got my cough back again. And it's annoying because it won't let me sleep.
I feel like I've got phlegm stuck across the back.
Chesty cough.
Productive?
What do you mean productive?
Coughing stuff up?
Oh, yeah.
I can't get it up, that's the problem. It's sort of here.
Oh, yeah, I can hear it.
Just like stuck.
Take some deep breaths in and out, please.
In.
I can hear it on this side, left side.
Benjamin Pulsford. Hello there. It's Dr. Hyder. Come here and have a seat. All right, so you had a chest infection recently, didn't you? Yeah. How are you feeling? Is it
good, actually? I feel like the antibiotics are working. I haven't coughed badly in a while. I still cough every now and again, but last time I took all the antibiotics and I still felt a little bit of pain, and they said it was normal, and then it came back.
Right. Okay, all right. So things have got a bit better, but you're a bit worried that you're coming to the end of them because you don't want it to come back.
Exactly.
So they found this, like a cavity lesion with infection in it in the right middle part of the lung.
Yeah.
And it had increased in size and there was like a fluid air level, so it looked like consolidation or infection. So because there can be a chance of this being something like TB, they recommend an urgent referral for you to see the specialist. A lot of people might think that TB doesn't exist in the UK anymore, but in fact it had never been eradicated, and it's only in the last 5 years that numbers overall have started to decline. So with those urgent referrals, they are referred on what's called a cancer 2-week wait referral. It just means that anyone that we're worried about with a lung unusual lesion, we want to see within 2 weeks' time to do further investigations. And you're very young, so I think it's unlikely to be something like cancer, but we need to make sure that it's not something like TB. Have you been exposed to anyone that's had TB?
None I know of.
We give babies and young children the BCG vaccination if we think they're living in an area where there might be an increased risk of catching TB. TB is more prevalent in areas where there's social deprivation, and it's important if you have any symptoms such as a cough, night sweats, weight loss, that you do see your GP, especially if you think you've been exposed to someone else that may have TB. Maybe that this is more of a complicated infection, like a pneumonia, that you feel a bit better from now, but we don't want to leave it alone because it's the second time it's happened, isn't it? So we want to get you referred. So it's a bit of an unusual chest infection that's been a bit resistant. The antibiotics you think are working.
Definitely working.
Yeah, I think I'll give you an extra week so you're not, at risk of getting unwell in the meantime or waiting for your appointment.
So I need to make another appointment or not?
Well, it'd be good to see you after you've seen the specialist in 2 weeks to find out what's happening. If you're worse before then pop in sooner.
Thank you very much.
Take care then. Bye-bye. Hello.
Hello, I'm coming to claim my prize.
Oh, let's have a look. It's a big teddy.
Yeah. Oh, I should have brought a bigger bag.
Yeah.
Hi, come on in. How are you? How can I help?
For the last 2 weeks, I've kind of not been feeling right. I've been feeling really tired and drained and just bloated all the time and constantly going to the toilet. I had a miscarriage in February, but I don't think it came out. So about 12 weeks ago, I had a D&C and a laparoscopy.
Right.
And they removed something. Still not come on my period. Literally in the last few weeks, I could be sitting there and I'll just fall asleep, and that's not like me. I've got a 4-year-old, but I'm not doing anything over excessive or anything like that. And I don't know, I just don't feel right.
Have you lost any weight or anything?
In the last year, I lost quite a bit of weight, and everyone kept saying, "Oh, you know, where have your legs gone? Where have your boobs gone? Where, you know, you're just shrinking." But now it just feels like I'll eat something and my belly feels like it's out here.
Do you think your weight loss is related to your mood?
Not really. I'm quite a happy, positive person.
And what about your sleep? Is your sleep okay?
When I sleep okay. Living with my mum, my daughter sleeps in my bed. The flat isn't big enough for her to have her own room.
And what do you do for you? What sort of things? Is there any you time? Do you get any time?
Not really.
No. Is that because they're a little girl?
Yeah. Okay. Occasionally, maybe of an evening, my mum will have her and I'll go and stay at my boyfriend's.
Is there any depression in your family at all?
My mum suffered from depression. She was off work for quite a while with depression and anxiety.
Do you feel depressed, do you think, now?
No, I don't feel depressed.
So how tall were you?
About 5'6".
So your BMI is just sort of 17 and a half, so that's underweight. It's quite difficult to get into this underweight category, actually, so that's quite significant. I think, you know, a lot of your symptoms are due to the way you're feeling psychologically, but they do have an effect on the way your body works and the way you feel about your body as well. So if you're feeling stressed and tired or feeling depressed, then it can make your body functions feel different, and you can have abdominal symptoms, you can have all sorts of other things that you might, if you're anxious, you might get fast heart rate, that sort of thing. So the mind has a big effect on how we feel about our body and how we feel it's working. What I want you to do is just do a urine sample. We should just do a couple of blood tests. Probably the most important one to do is the full blood count to make sure you're not anemic or nutritionally lacking in anything, and the thyroid test, because if your thyroid gland overworks, you can lose weight. And then if we bring you back next week with these results, it'd be nice to catch up and we can go through that. Okay.
Thank
All
you.
right. Okay.
Just when I cough, my chest has been pretty hurting along with walking as well.
Now the chest pain, tell me about the pain. Is it a sharp pain when you're coughing?
Sharp pain is literally centralised smack bang in the centre of my chest. And it's just like, feels like a bang across my chest, really tight.
Okay.
Because I've had heart problems before.
What heart trouble again?
It's swollen ventricles.
Any sweating, nausea, vomiting, dizziness associated with the chest pain?
It's when I cough, I get a bit dizzy, and apart from that, it's just constant coughing, just chest pains, and it's restricted breathing, really.
Okay, jump over here for me. Let's just arm like this for me. Okay, now, I'm just going to have a listen to your heart, if that's okay.
Yes.
All right, and take some nice big breaths in and out. And again. And again. Okay, come and grab a seat for me. Now, Owen, there's a very good thing. So the good things are, your temperature's perfect, your oxygen levels are perfect, your heart rate is perfect. However, the thing that concerns me is when anyone gets a tight pain on the chest, we need to make sure this is not related to the heart. Does that make sense, okay?
Yeah.
And the best way to do that is by getting a blood test done. That really should be done at the hospital because, of course, if that comes back as abnormal, then they need to action and make sure that there's nothing else worrying going on. Does that make sense? So I think that's what we should do today. I think we should get that done today, okay?
I'll have to swim past work first, though.
You should go there now,
Okay.
all right? You don't need to worry about work, because if you do suddenly develop, tight chest pain, you feel like you can't breathe, you're sweating, nausea, vomiting, dizziness, then that could be the heart. You call 999, you get yourself to hospital via an ambulance. Does that make sense? Take that straight up to A&E reception. When you go up to them, just mention that you've been sent by your GP for chest pain.
That's fine.
All right, buddy? No trouble. And make sure you go straight there now.
Mr. Tagala, please. I've got a medical student with me today, if that's okay. I'm Dr. Tawana. Nice to see you. So I think you spoke to one of my colleagues, something about bleeding from the back passage.
Yeah, that's right.
Tell me a bit more about what's been happening.
Well, I had a bit of constipation about 6 days ago.
Yes.
So after that, started bleeding.
Yes.
I really...
So with the constipation, let's just double check, were you really struggling to pass the stool?
I did.
Okay, and then after that, that's when the bleeding started?
That's right.
Okay, talk us through then the bleeding then. How's that been happening?
It was like, spray.
Oh gosh, okay. Into the bowl?
Yeah, bright red blood sort of thing.
Sure. And has there been any pain from the back passage at all? And when did it start?
It started on Thursday, I think.
Thursday?
Thursday.
Okay, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, so 6 days now.
Yeah.
It sounds like, just from your description, the main problem here has been constipation, and as a very hard poo has been passing through and you're trying to push and squeeze, it's caused a tear, probably.
That's what I thought.
Not serious, normally does settle by itself, but we need to examine you, if that's okay. So that does mean popping finger into the back passage, checking around. We're going to be looking for piles, anything else internally, checking for any obvious blood. And just give me a shout when you're ready.
Yes, I'm ready.
You're ready? OK, just bear with me. I'm just getting some of the bits we need.
Okay.
He gets terribly constipated. The only thing that's really sort of made him go at all was prunes. I tried everything else and there was no shift in him.
I've had diarrhea for the past 3 days.
Oh, okay.
Right, this morning it was like 6 o'clock. Half past 6.
Really? I'm fairly loose at the moment anyway.
Okay.
And last week it was jet black.
Yeah.
It's gone to a nice brown colour now, so.
I've been increasing my fibres, so now I can actually poo easily, so.
The trouble has been at the start very hard, like frozen peas, if you like, to it dripping out you like very, like milky chocolate, if you like.
Right, okay.
Let's take that through, OK. All right for me to come through? Yes. Yeah? Is it all right for our medical student to come through as well? Yeah. Yeah, is that all right? Thank you. I'm just going to pop the light on. Okay. The first thing we do is just literally just check in and around the back passage, making sure there's nothing we can find there. So just checking the back passage. And actually, a bit of a skin tag just on the outside there. Try and relax as much as you can. Cold jelly. Big deep breaths for me, in and out through the mouth. Any pain at all?
No.
No, OK, good. Normal anal tone.
There is a little.
There is a bit of pain. I think that's probably where you've got a bit of a tear. Yeah, OK, that's fine. Checking for any blood. There's no blood on the gloved finger. OK, pop your clothes back on and come round. Since the initial constipation, how have your bowels been? Has the stool become
good? But
is the stool a bit softer or not quite?
It's a little bit softer. Yeah.
Fine. Okay.
Probably I didn't. Yeah.
So no piles. No. Nothing serious that I could feel internally. Nothing to find on the outside that's worrying me. It's definitely a tear, small anal tear that's been caused because of the hard stool that passed through, and you probably strained to pass that.
Right.
There is no treatment needed for this. It will just heal up by itself.
Slowly.
Most important thing is to give you advice about trying to keep the stool soft so that you're able to open the bowels without the pain and without straining. So things like pears, prunes, anything that's high in fibre, plenty of fluids as well, those will all be quite useful moving forward to help the constipation. It should settle. I think it just needs a few more days. But of course, if you have any concerns, if the symptoms suddenly flare up, there's pain, then come back and see us.
All right. Okay.
All right?
Yeah. All right.
Thanks for coming in.
Sorry to bother you.
No, no, not at all.
I thought just double check.
Best to get it double checked. Yeah. Bye.
Morning. So we're doing dressing on your hand, is it?
Yeah.
Okay. So did you have surgery or?
I had an accident, or rather, an argument with a tractor.
Oh, right. You had an argument with the tractor. Right.
The tractor one.
So sit here for me. I want your arm there, please. Or your. Yeah. Have they kept
my
you
wrist's
in?
completely destroyed.
Oh.
It's held together with pieces of metal.
Oh, right.
I've been going to the plastics dressings.
Okay.
Because there's a
Okay.
skin graft.
Right.
Basically along there. Oh, broken fingers.
Oh.
Broken fingers.
To not
destroyed
together
wrist,
with that.
broken rib, broken neck.
Anything else? Oh dear. Okay. That is all dry. It's just area open here, isn't it? Can you see it here?
Yeah. I think that's where they were putting the...
All this looks quite nice. Healed, you see. Can you feel anything?
Not really.
Uh-oh.
Wrist is definitely stiff and painful at the moment.
You should cover with the painkillers because don't suffer with pain.
It's just uncomfortable rather than painful.
Okay. Now the iodine needs to heal this open wound, you see. You've got very much pain, so I want to be very, very gentle
That's
with
fine.
you. Then I shall bandage it, okay? Give me your left hand just on that little side. Okay?
Okay, thank you.
No problem.
Okay, so another appointment for next week?
Shall we do Thursday again?
Thursday sounds fine.
All right, nice seeing you. Take care.
Thanks very much.
Bye-bye. Oh, solid sweet hole. This was a lot. Oh, God. I thought I was going to choke on that then. That's what. You okay? Yeah, I need a drink of water. I can feel it here.
What can I do for
The
you?
reason I've come over to you is I broke my finger.
Right.
It was very swollen, so I thought to myself I've dislocated my finger. Waited till the swelling went down.
Yeah.
So I came
Were you trying to relocate
yes,
us
because
yourself?
I've done it in myself once upon a time. So I thought, I can't do that. Now, the hand was fine,
Yep.
but it's swelling, and I am concerned about the swelling. It doesn't come out until the 14th of June.
Okay.
I take the standing pin out.
Yep.
Now, swelling there, and it's very sore here.
So you're feeling more pain now than you were feeling.
Yeah, and it burns. It gets very hot.
Yeah, and I suppose our worry is if you ever get some infection in there, that could be nasty. I've seen people with all sorts of pins sticking out of everywhere, really, with these sorts of things. But it's quite impressive, isn't it?
It's very, very impressive. Well, I can take this off when I'm sitting down to relax the hand.
Yeah.
But then I have to put that on when I'm in bed because you know how you turn in bed and you want, there's a hook. It's like a hook and it catches. Now, they give me an antibiotic because I'm allergic to penicillin.
Okay.
So the only one they had was terramycin. I was like a womble. I couldn't understand why I was feeling so giddy.
Really?
And really giddy. And stupid.
Okay.
And I looked on I so happened to say to myself, well, read the leaflet.
Yeah.
And it said that it interferes with your blood pressure tablet, the amlodipine.
Okay, yeah.
Whenever we prescribe antibiotics, we should really take a good look and see what other medications people are on, particularly because some antibiotics will cause problems with other medications that people are taking. In Mary's case, I think some of the antibiotics she was taking led to her blood pressure tablets becoming more effective and dropping her blood pressure.
Should we try something else?
Yeah.
Let's go for old-fashioned erythromycin. Eh? You
Yeah.
need to be careful and see what it's like when you're taking it.
And not take the statin when I'm taking the antibiotic.
Don't take the statin.
Thank you so much.
No trouble.
If I could have killed myself, I would.
Yeah, look what happened last time.
What time are you on till? 6:30? 4:30? 5?
Mhm.
Is that half day?
No, I've been here since 8:30.
I went to the one at 8 this morning and then here till 8.
Look at any easier. Stick that on there.
Right, come and have a seat, Thelma. So, what are we doing today? Remind me.
Well, I'm terrified. You've got to give me an injection.
All right, lovely.
On there.
So you're going for some surgery or other,
Yes,
are you?
Thursday.
What surgery are you going for, Thelma?
Ah, the worm again. So I keep bleeding, don't I?
And your chest is okay, just so saying about your asthma review. Is your asthma all right?
Yeah, I seem okay with the old breathing, yeah. I just felt a little bit tight.
Tight?
Yeah, because I can't bear to wear a brassiere. I don't bra.
Mm.
Oh, look at me, brassiere.
Brassiere.
I don't remember last time I said that.
Brassiere,
I'm thinking of my mother.
You're talking about
Yeah, bra.
girdles next.
Yeah,
girdles and
Oh, I used to wear them as well when I was young and slim. I don't know why. I need one now. But yeah, I cannot bear to be restricted.
Yes, yeah.
I can't wear a bra or anything now as I'm getting bigger and older.
Good, good.
Definitely not.
Okay. Right. So what we normally do is give it in the stomach. Okay.
Yeah.
So we just pinch, jab. It's a bit stingy. It's a bit stingy.
Is it?
But it shouldn't be painful. Just a bit of a sting more than anything else.
I don't like injections. The worst one is when you do there on the finger. Set on my own bloody doodah. Let's get some skin, shall I?
That's lovely. That's lovely. Well done.
Is that it?
Yeah, that's it. But as I said, because it...
Do you know how much I've been dreading this?
Because it does the job.
Because I swear. You're amazing. That is amazing. That's better than the R&R.
But because it does the job that it's doing, you can get quite a dark sort of bruise
Doesn't
there
worry me.
afterwards. That's it. That's done. Okay, lovely. So you've got those appointments booked. That's fine.
Yeah.
And yeah.
Is it you tomorrow, 12:10?
It is me again tomorrow.
It is. That's
okay,
lovely.
So,
You're an
yes. All right then. So you know not to worry next time.
I know. Well, I've got to run in it tomorrow. I won't have sleepless nights. You're an angel. Thank you.
All right then. Take care.
Good day.
Bye bye.
We said green was the colour green. Why can't it be diddly dabs?
Dibbly dabs.
Yeah, the colour diddly dabs.
Dibbly dab.
Yeah. Why can't that be a new Jimmy Flake, which is when I can't remember. Yeah. So why can't this be a donga? Yeah, and why can't that be a flower? Who thought of names for things? Come on, I want to know.
Come have a seat. Hi.
Talk about that throw last night and bloody hell.
Okay, so the amylase that we were testing, the normal range is about 28 to 100.
Amylase, what's an amylase?
So amylase is a marker that we use to see if there's problems with the pancreas.
All right.
Okay, and if it's under 100, then we're usually quite happy, and yours is 933.
Jesus.
Yeah, so if it's that high, we wonder whether the pancreas is inflamed, and that can be related to the alcohol as well. And it's the same message, really, isn't it? Because, I mean, I know when I first met you, you did really well because you got yourself down to about 6 cans, right?
Yeah, I got down to about 4.
But then when I spoke to you in November, you were telling me about the same, right? You were telling me 4 to 6 at that time. So
Yeah.
I think you've done really well where you are, but I still think you need a bit of extra help. Hugh, I've seen quite a few times, and many of those times I've advised him to go to a specialist unit for his alcohol dependency. The reason for this is because he will get more intense support It will be much safer for him because he'll get advice about how to reduce his alcohol safely and not too quickly, which can be a risk to his life. They're there to try and help you with practical ways to get you off. And if your head's in the right place, they also can arrange community detox. So that's where you go through a prescription to completely stop and be able to do that safely without then fitting.
See, I just, to be quite honest, doctor, I don't want to be going in as somebody telling me what drinking does and what drinking does, you know what I mean? I feel that I can do it. I don't need it. I feel I can do without it.
He needs to make that choice. So it's often our frustration is that we will make recommendations to patients like you, but not until they're ready will they actually go. You know, your situation is that you don't have much choice really in that sense, because the risks to your health and your life really, because you're at that stage where we know you've got cirrhosis. We can see from your blood test that your liver is really stressed, really stressed with this. Physically, your body's saying we need to get to a stage where you stop. So the bottom line is we've got to address it.
Alcohol. Drink much alcohol?
Depends if I'm going out on a weekend. I'll have a drink with my friends.
How much alcohol are you drinking at the moment?
Probably about 2 pints a day.
You smell of alcohol. Have you been drinking?
Yeah, I've had 2 drinks today.
2 drinks, yeah. Do you drink the whole day?
No,
I do drink a lot sometimes.
Okay. When you say a lot, what are we talking? A whole bottle of something, or is it just...
Well, I'm with friends, so it's hard to say. Have you tried to cut down?
I don't need to.
Where you are at the moment, you couldn't just stop like that because you'd be at risk of fitting and that could, risk of death, right? And I don't want you to do it unsafely. I don't want you to walk out here and then just stop completely and then, could go through the shakes and have fits and stuff, because that's a risk as well. It is possible to die from the withdrawal effects of alcohol, especially if you're a dependent alcoholic. If you're a heroin addict and you have a withdrawal, you won't die. Whereas if you're an alcohol-dependent patient and you withdraw just like that, then there's a risk to your life. They might have an alcohol withdrawal seizure, and as a result of that, they could swallow their tongue and be unable to breathe and then die.
And you haven't forgot about this, doctor?
Can I have a look? Because you know what, we could probably do it today if you want.
Yeah.
All right, and then we'll get you up here. All right, so you're just going to feel a sharp scratch coming now, okay? Just want you to stay nice and still for me. All right, that's the worst bit.
Okay.
Can you feel anything sharp there? No?
No. Bleeding a bit, yeah?
Yeah. It's because it affects the liver, makes clotting factors to help clot. When I removed Hugh's wart, it bled a lot because of his chronic liver disease. It's bleeding away on us. Yeah. His liver doesn't produce the clotting factors that you need to be able to stop a bleed from happening. I think we might need a gauze to start off with.
I think it's coming down by the eyebrows.
Yeah, it is. Any time that you might have a cut or an injury where you might bleed, whether it's internally or externally, you have these clotting factors that will stop that bleed from becoming life-threatening, whereas a patient with liver disease doesn't have that ability anymore.
It's like cauterizing it, or...
Yeah, effectively, yeah. All right, round 2. As long as we don't get any blood on your shirt or your jumper, we'll call it a success, shall we?
Don't worry about that.
You okay?
Yeah.
You're slowly winning. Well, that was a lot harder than I was expecting when we started.
Should have been 2-minute job.
Yeah. We spent more time on this than we talked about the really important stuff, isn't it?
Yeah.
Cheer up, ladies, ain't that bad.
How are you?
Not too well, I need your help.
Just take a seat. And what can I do for you?
Right, I'm experiencing bad heads, dizziness, the pain in the head. It's like, have you ever bitten on an ice lolly?
Yes.
Right, well, that's how I describe it.
So when you say dizziness, do you mean the room spinning round?
Not exactly. And when it's bad, Doctor, I have to describe it like this, is when I'm drunk. Well, I've never. I don't.
But you feel?
I have been in my young... But that's how to describe it.
Is it there all the time?
At the moment, yes.
And so, say if you're sitting down and you turn your head or look up,
then, yeah.
That, okay. All right. Good, that's fine. And you have a discomfort behind your eyes as well?
Yeah, behind the eyes. There. Yes, you've got it. Oh, dear, yeah.
Sorry, yeah. Is it tender if I press there?
At the back.
What about here?
Not so bad.
How's that? Bit uncomfortable?
Yes, yeah. Oh, dear. What is the matter with me?
Well, wait until I finished, yeah. Right. Just look at my finger and just follow my finger across. Good. Just follow it up. And down. Good. Now, I think this is crystals in the wrong place in your inner ear. And you don't know where you are, so you'll feel unsteady. Now, what we've got to do is we've got to manipulate your head and your neck so that the crystals get back into the right place. You're the last patient I have, so I can spend that time with you if you wish.
I do wish.
Okay, good, okay. So, what you need to do, you want to put your bottom there. So you're sitting up straight, okay? But just come right back with me now. That's right. So what I want you now is turn on your left side. I'm going to hold on to your head. You've got to move your body round to the left side. Look at my forehead. Keep looking at my forehead. That's right. Good. Good. Well done. And I'm going to hold it here for about 30 seconds, okay? And then we'll just do it once more, okay? How are you feeling now? How's your dizziness? I'm just going to move. Good. So just sit up for me now. Just take your time. Good. How are you feeling?
Oh, yeah.
Feeling a bit better?
Yeah, you're just...
Is it amazing?
It is.
It is, yeah. That's called the Epley maneuver, okay? Just stay there for a few minutes. Just recovering from that, okay?
Yeah.
Good. So, come down. Good. So that's all we need to do.
Okay.
And then you tell me in the next 3 or 4 days how you feel.
Exactly.
And if it comes back, let me know and we'll repeat it again.
Thanks for seeing me.
That's so nice to see you. Yeah. You take care. Bye.
Thank you very much.
Okay. All right. Bye. Take care, and I'll see you in a few weeks, yes?
Thank you so much.
Okay, see you later.
Bye.
Bye-bye.